Beauty is something that kind of just shines. Like you can look at someone, you can be in the presence of them, and the happiness, the confidence level that they feel, the surrounding themselves with other people that are like-minded, they're going to push them forward. That all enhances beauty.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gal here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Krystal K, also known as Injector Coco, a licensed aesthetic injector and the founder of Alpine Glow and Wellness Med Spa in West Asheville, North Carolina, operating under the medical direction of Dr. Suzanne Lavelle. Krystal brings over 14 years of experience as an ICU and emergency room registered nurse, giving her a deep clinical foundation and calm, safety-first approach to patient care. Prior to aesthetics, Injector Coco also worked as a high-end jewelry and luxury watch consultant and as an international flight attendant, experiences that shaped her refined eye for detail and elevated standard of client care. She specializes in natural-looking injectables, facial balancing, and wellness-based aesthetic treatments that helps clients look refreshed without looking overdone. Her mission is to create a welcoming space where beauty, wellness, and confidence come together. So, Krystal, welcome and glad to have you here.
Thank you. I'm glad to be here.
Yeah, so let's start off with this. How did you first get interested in the medical field? Let's start kind of at the very top.
In the medical field, it happened a long time ago whenever I was probably about 17, 18. And then I went and I started traveling. I wanted to travel the world. So then I became a flight attendant. And then I was the only one on the plane that would clean up anything as far as like if anyone had any accidents or anything. So I figured I would just go and be a nurse and stay stateside. And then after that, I was like, I want to travel to see where I want to be. And then I became a travel nurse. And then after that, I met a friend of mine and she's in Dallas, Texas. And then she got me into doing aesthetics.
Okay. So
during COVID.
Yeah, so I guess
yeah.
So with that transition over to aesthetics, what was it about aesthetics that really drew your attention?
It was just the feeling of looking in the mirror and seeing something that you don't particularly care for. Not that you don't like, of course you like yourself. It's just something that you think, I wish I could do something better with this. And I wish I could talk to someone that doesn't just want to sell me something. I wish I could talk to someone who's going to be like, yeah, that totally makes sense. I can see where you're coming from. Why don't we start low? We'll start slow. We'll see how you feel about it. And then we'll keep going if you like it. I wanted to be that person for people. I wanted to make it comfortable.
Okay. And what led you to decide to start Alpine Glow and Wellness? I mean, why start your own practice? Why not just work somewhere else?
Well, when you go into working with someone else, you kind of get into their culture. Like they want you to do how they want, like they want you to train and sell the way that they want you to sell and everything like that. And I'm not a pushy injector, so to say. It's more education first. So you come in for a consult. I want you to feel comfortable. And I wanted to open a place that made people feel comfortable like that. Basically, like you're talking to your best friend or someone, maybe not your best friend, but I mean, your injector is your hype girl. Mm-hmm. So someone who's going to talk to you and hype you up, but let you feel comfortable in saying, no, that's not okay. Or yes, absolutely. I want to do more. I wanted to open somewhere like that. So that's why I decided to open my own practice instead of flowing into someone else's culture.
Got it. Okay. So now that you have your own practice, I want to talk about some of the treatments that you provide and this concept of you treating the cheek and smile lines, but without overfilling it. So can you explain a little bit more about what goes into that?
So when someone comes in, you really want to do like some facial balancing. So if I were going to come in on myself and I was going to look at myself, I would see these cheeks right here. I already have cheekbones. I don't need to go more. So if I was to put more cheek filler here, it would overfill and get that maleficent look.
Mm-hmm.
Yeah, which is kind of it's very harsh. We want to keep it very soft and subtle, just adding to someone's already beauty, and not overfilling it and making it look abnormal. I want to keep everything North Carolina pretty, natural.
I like that. That's a good tagline. Yeah. So with facial balancing, you mentioned facial balancing. How how do you define facial balancing for someone who's never heard the term before? Like, what is it?
So one thing that I show my clients when they come in, because ultimately you have to have a baseline so that they understand what's going to happen, what we're working with. They may not see things that I see. I have to see everything in order to treat their face and them not walk out being like, this is misshapen. So if you look, my face is like this side is longer. This lip is longer, this ear droops longer. So I have to put more filler in on this side than I would on this side. If I did it even, this side would go higher and this side would just hang. So
Mhm.
it's the structure underneath and making sure that you show them exactly what you're going to do and how you're going to rebalance their face. It just to make it to where it's all even when you look at it. Because if I was just to go in and just do half and half or one syringe, it could emphasize
Mhm.
the unevenness. So
Okay.
I just kind of explain that in detail. And if they look like there's still question marks in their eyes, then I'm gonna keep going.
Got it. Okay. And what is your personal philosophy when it comes to facial balancing?
Less is more. I know I will take anybody's money, okay, but I'm not going to do it if it's not going to make you look good. If
Mhm.
you so I will only recommend things that I think are going to benefit. I mean, I will do what someone wants to do. If they come in and they're bent on doing something, I'm not going to make you unhappy, but I'm also going to make sure that you know what you're asking for may not be the best. But someone coming in and asking for cheek filler, chin filler, you have to start with the cheeks and go from there. Did I answer that question? I think I got off on a tangent.
A little bit, yeah. But we can go into a little bit more detail here as well. It's fine.
Yeah. So, but doing the structure, your cheeks are going to be what lifts up your face. And without that, you can't really touch anything else. We could start. I would never want to start down here around like the lines around the lips,
Mhm.
because it's just going to hang. It's not going to give justice to it. So you'd
Mhm.
always want to start with that structure and the bone that we lose as we age around the cheeks. And
Mhm.
then after that, you can pull back. Say, if someone has a strong jawline, I don't want to add to this because women, you want to keep a heart-shaped face, and men, you want to keep like a box.
Mhm.
That's it's feminine, masculine. And
Mhm.
then that back, I would pull back on the jaw right back here because a lot of men and women actually don't like the jowls. So
Mhm.
I'd first do the cheeks and then I'd do the jawline back there to pull back on the structure. And
Mhm.
then we would assess the lines around the mouth.
Okay, got it. Now,
Facial balancing.
yeah, got it. So when you're doing facial balancing, are you mostly using filler? Are you also using Botox? Are you doing a mix of the two? Like, what's the most common as far as between filler and Botox when you're implementing facial balancing?
Oof, it's a mix. And then there's also a skincare regimen. And I'm not going to go like real deep into skincare regimen. It's a whole nother teaching product.
Mm-hmm.
Um, but if your face is not getting the nutrients it needs, it's going to continue to get worse in the wrinkle area.
Hmm.
But if someone had like their face was kind of a little more flat right here as we lose our cheekbones, I
Hmm.
would obviously want to do some cheek filler. If someone doesn't want to do filler yet, yeah, we can start with some Botox. Botox is not going to fill anything. It's not going to give structure. It's just going to relax those whatever muscles we're going to target for the tox. And then the skincare will, if you do like especially vitamin C and tretinoin, those are going to tighten up and create collagen underneath, which helps underneath with the elasticity and the bounce of the skin. But if they are open to filler, I would recommend um, to start one syringe in each cheek. And then I would do tox, like the recommended dose if we were doing Botox and someone had never had it, probably like 64 units, 12, 12, 20 in the middle and 20 on the frontalis.
Hmm.
And then recommend a good skincare regimen.
Got
And
it.
it's a lot. It's a lot for people, especially someone who comes in who's not familiar with it, to get exposed to this and, be like slammed with all this information. So I try to like check in with the client and
Mhm.
be like, are we okay? How are we doing?
Okay.
You know?
So it really kind of depends on what their overall goal is. Is from that's going to help you determine, hey, should we use Botox? Should we use filler? Should we use both? It sounds like that's kind of the way that you look at it.
Oh yeah, definitely. And not only that, like one of my first questions is what's our budget?
Hmm.
Because it's huge. I mean, we can get expensive in the office. So I just want to make sure that I'm budget conscious and that someone doesn't leave being like, what did I just do?
Mhm.
I want them to feel like, okay, I know exactly what I'm going to do. I feel comfortable with this. I also offer like payment plans, which are like cherry and stuff. It's not really like a credit card, but it gives them the option to do more with what they have.
Mhm.
But yeah, it's a combination of everything. And if I don't ask my clients and talk to them and get a good feel for what they want instead of just what I want to do, they're not going to leave happy. They're
Mhm.
not going to come back to me or refer me to anybody.
Yeah. Okay. So now when it comes to these types of the facial balancing, the filler, the Botox, I'm sure you hear a lot of misconceptions or myths from your clients. What would you say some of the most common myths or misconceptions you hear about these types of treatments?
One of the biggest one is like you're hearing people, especially on like TikTok, and they're like, "Oh, I stopped using Botox and everything is still frozen and everything's good." Well, it's going to be like that for a little while because whenever you start using Botox, it freezes the muscles. And then once you stop using Botox, you go back to where the muscle was when it was frozen.
Mhm.
So say for me, this hasn't moved in a good 8 years.
Mhm.
Okay. So my muscle movement would go back. I'm 42 this month. So it would go back to when I was 36. That's where my movement would go.
Mhm.
But it would also start progressing. So if you stop using Botox, your muscles are going to start working again. That's a huge misconception. Um, Bad results come from too much too fast. Uh, Honestly, you can only paralyze so much. You can paralyze it for a longer time if you get underdosed, or like I hear clients come in and they're like, I only get 20 units. I'm pretty sure that the injector gave you what they wanted, but they told you it was 20 units because that's what you could afford. We will try to work with that, so those are misconceptions. And then, yeah, it's the unknown.
Mhm. Okay.
Yeah.
Okay.
Is that
So
good?
yeah, so I mean it's mostly just I guess education. They just like the education. It's just you trying to educate them as much as possible on what really goes into this and
Yeah.
just clarifying that mystery behind it.
Yes, it's huge. I mean, people walk in and they have no idea. They just know that there's this world of tox and fillers and aesthetic and no movement in the face. And how do I get that? And then some injectors are just like, this is what we're gonna do. This is what we have to do. And people feel overwhelmed because they're like, oh, okay. When I'm injecting you, I'm gonna show you the muscles that I'm gonna inject and why I'm not gonna inject over here. Like I'm like, make a mad face. I can't do it, obviously, but make a mad face. And when you do, you'll see the muscle that's being pulled. And I'm going to show you where I'm going to inject. It kind of gives like a level of ease.
Okay. Okay. Got it. Now, Krista, when it comes to some other treatments you provide, I know that you provide wellness treatments as well, GLP-1s, peptides, things along those lines. Why do you think it's important to include wellness in with aesthetics?
Well, with GLP-1s and peptides are going to help from the inside out. So you've heard of like the glow up peptide,
Mm-hmm.
BPC 157, TB 500, and the copper peptide that's in it. So that BPC 157 is going to help repair tissues. It's going to help repair with like the gut lining, which, inflammation within the body. It decreases that. If you're not constantly having inflammation in the body, then your body can repair.
Mm-hmm.
So if your body can repair, then the cells can work on other things. They're not busy. I could nerd out on this. Okay. I do with my clients. My first consultation is very in depth with clients on this stuff because I do a good faith exam with a nurse practitioner or a PA, and in order to get cleared, and they have to ask them, "Are you comfortable with peptides? Have you been explained?" And they're like, "Oh yeah, I know all about them now." But working with peptides from the inside of the body allows the skin to repair itself to where I don't have to do as much fillers, Botox, stuff like that. Like it just goes hand in hand.
Mm-hmm.
Um, it's like putting oil in a car. If you don't have the oil in the car, then it's not going to run as well, right? The engine's not going to, it's going to stink up, whatever. Anyways, bad analogy. Um, then GLP-1s, you have a lot of people that are coming in. They are not happy with what they see in the mirror. Our bodies are what we drive consistently. I'm a big fan of back in the day, X, when he was like, pimp my ride.
Mhm.
I honestly have pimped my ride. Okay. I've put the most money into this, and I've put money into my car, of course. But yeah. So if you looking at GLP-1s, if you're not happy in the mirror and you're having struggle with like losing weight and things like that, we'll work on that. After you take that, we'll do some peptides to blend in with it to make sure that your skin is tightening up with the loss of the weight. We're going to do some Botox, maybe some fillers to go in and correct anything that's starting to say sag, as long as we can, as long as it's not going to be overdone. And then hands down skincare. Because if you're not putting anything on to tighten up what's starting to get loose from the GLP-1s, then it's gonna go south.
Okay, good to know. Now, let's say, Kayla, that someone is looking to do some type of aesthetic treatment,
Yeah.
but they don't know which provider to choose, and they don't have any references or referrals. What is the most important piece of advice you can give to that person as they do their search so they can find that provider that is knowledgeable, that knows what they're doing, and can basically get them the results they're looking for?
So what I did before I became an injector is I looked at reviews. I asked everyone. I am new to the area. I'm not in a walkable area, so everything I do is based on reviews. So when people come in, they've literally read the reviews on my site to make sure that they know what they're coming in for.
Hmm.
I have several clients who've come in and they're like, one of them, she's African American. She's like, there's not a lot of injectors around here that do African Americans. The whole community for African Americans, it's not like talked about, Botox fillers, all that stuff. We go into depth about it.
Hmm.
She said that she read my reviews, and that's how she was able to find me and know what to expect whenever she came in. I have another girl who left a review on it's on Google if anybody wants to look at it.
Hmm.
Uh, I am a big advocate for reviews. Like, I want you to be detailed. I want you to be honest on how you felt when you walked in. But I think if you're looking for an aesthetic injector, those reviews are everything. Don't tip me.
Hmm.
Leave me a 5-star review if you want.
Hmm.
Okay, leave me whatever review you want. But I want what your experience to be conveyed so that someone else can be like, hey, this is where I want to go because this is what she did for her. You know.
Hmm. Okay.
So I would look at for someone that is listens first. It should feel like the treatment plan is a one-on-one. It shouldn't feel like they're telling you this is what you're going to do. It should feel as if they're listening to you and they're taking into account what you want. And if it's not in the budget, then they should adjust, or think about a plan for the future.
Hmm.
Um, it shouldn't feel rushed. They should have enough time to have you. It shouldn't feel like you're just in like a line, getting ready for the next person.
Hmm.
Um, yeah, just a provider who listens first.
Okay, great advice. Now, Krystal, when it comes to your particular approach to client care, how important do you think creativity is in what you do? I think that's something that not a lot of people think about when it comes to medicine, but what do you think about creativity and what role it plays in what you do?
Oh, creativity is huge. I mean, you're an artist. So basically, going in, you have a needle, you have a canvas, and then like I'll do a lot of cannula work, which is where you stick the cannula in and you can guide it along the area once you have gotten your structure on the bone with the filler, and you've placed it and it's good. Then you can go in and you can design pretty much. You can create that chin or that cheek line. You can bring down the jawline so it should need. But it's about creativity, is about looking at the client, having listened to what they want, and then being able to see it. Just, what am I going to do? Create a plan within your mind. And if you're not creative with that, it's just going to be a little bit harder. You're not going to get what you want. But I feel like most injectors that are out there have got this creative, what is it, left brain?
Mhm. I think
That is it left or is it
I
right?
can't remember.
Goodness.
I believe
Oh,
it's after.
yeah. You got what, the creative side of the brain. And that, I'm probably going to get hit on that one. People are probably going to be like, oh my God. I think I'm just nervous. Anyways, but to be able to be creative in this business is key. You have to think about the different products that you have. What could I use? Someone's complaining about the lip lines that they have that they don't like. Maybe they drank out of a straw too much, or unfortunately smoked, but now they're done, which is yay. Now, how am I going to fix it? What product would I use? Would I want to use like RHA2, Redensity for the lips. What I want to use, Volbella. Obviously, Volbella is great. It's a Juvederm product that you can use in the lips and you can also use on the lip lines. Maybe am I going to use Velour? Am I going to use Voluma? Am I going to use RHA4? Like we're, just knowing your products, your Revance products, your Juvederm products, your um, Galderma products, like everything. But if you don't have that basis of products, then you don't know how creative you can get and knowledge and all these conferences that all these injectors go to. It just explodes the possibilities in your mind once you like see what they're doing out there and how creative everybody can be with like the Radius, the PRP, the regenerative underneath, the Sculptra. Like it's insane. It's so exciting. I
Mhm.
don't know. I get pretty excited about
Yeah,
it.
it's almost like it's like a jigsaw puzzle. You have all these different pieces, and it's just a matter of how do you piece it together to get the best result for your client.
Oh yeah, absolutely. Yeah, it's just a huge work in progress. But then you also have to think about, well, also, okay, so we're doing all this, but have you thought about like the peptides? Like we're doing this, but I don't want it to just go away. I don't want it to go away in 18 to 24 months. I don't want you to waste your money. I want to build from underneath. I want to do Sculptra that's going to build the collagen and, like 3 treatments every 6 weeks in between and do some peptides that's going to help, boost that, decrease inflammation, help boost your collagen with the copper peptide. You want some hair growth, we'll put the copper peptide in there with that, you know. Yeah, we got Obagi, and then they came out with a hair product now that if it touches a hair follicle, it'll grow.
Hmm.
But if there's no hair follicle there, it won't grow.
Hmm.
But then if you stop using it, it's not going to go away. Like some of these medications, like that you put on your hair.
Yeah.
So the creativity is just having this base of knowledge and being able to pull from it. Oh, this one needs this, or you're going shopping.
Yeah, that's a great way of putting it. That's a great way of putting it. Now, Chris, I'm sure that throughout your career, you've had some maybe memorable cases or even challenging cases. Is there maybe one story that comes to mind that you can share of one of those cases and how you were able to get them a successful outcome in the end?
Oh yeah, I just had one. Um, she came in and so, and she'll be okay with me talking about it, but she went to an injector and they did what they said full face and 8-point lift, which is basically facial rejuvenation. They started doing 8-point lift is what they said it was, but basically it's full face rejuvenation. But this side of her face is higher. Like
Mm.
I drew it from her ears out, and you can see like that or whatever. So like this ear is higher. So when that case, you don't want to put too much filler, like I was talking about earlier. And on this side, you want to put more on this side to lift it up. So they didn't do that. And when she went back, they had overtoxed her and her lip was going up like this. This was up. This was a little more down. She's in the public eye. She takes
Mhm.
pictures all the time with clients and things that she does in her personal life as well as her business life. She went back in and she asked them and said, they were like, no, we think you're fine.
Mhm.
And so she came to me and she was nervous and she was scared and she sat in the chair and she's like, I don't even know if you can fix anything. And I was like, absolutely. And she's like, are you even seeing what I'm talking about? And I was like, 100%. I saw when you walked into the lobby, like I can into the waiting room, I can see exactly. Just have a seat. We'll go through a plan. We'll figure it out. It took 3 appointments because the third appointment was just a little touch up on the tox that she wanted to do because it worked well and then it wore off and she wanted to do a little more.
Mm.
Um, but yeah, she's able to smile. Her husband is happy with the situation now. He was scared for her to ever go do anything again because he loves her, you
Yeah.
know. She's able to take pictures, she's able to do Zoom calls, she's able to be face first instead of like to the side like she was having to be. The
Mm.
confidence level just soared. Now, I mean, I could get emotional because it's just awesome. Now, there were several times where she had called me. We had to overfill one side of her lip compared to the other. And when doing that, it takes about 2 weeks for the filler to settle. So there's a lot of texting and phone calls and pictures during that time. And I was like, it's okay. You're going to be fine. And then she came back and she was, after her 2 weeks, follow ups each one. And she's like, I'm glad. I was like, I will inject whatever you want, but I do not think it's going to work that way. We need to do it this way. And she's like, okay. And client for life.
That's awesome. That's awesome.
Yeah.
That's a wonderful story.
Yeah, I'll have one more and it's quick, but there's a woman who came in and she went to another injector, and in the injector, it told her that her face was just, she's like, you've lost too much weight. Your face is flat. And I was like, what? She said she would leave that office feeling ugly. And I was like, you should never leave anyone's office or anywhere, anytime feeling ugly. So I was like, I want first and foremost to make sure you understand you're gorgeous. Whatever you want to do, we'll do. And we have worked on her and probably 2 times, and she feels great. She looks great. She's got this confidence, which gives you a glow.
Mhm.
So
That's an
that's what
awesome.
I'm about.
That's another awesome story. I think it's really just about getting your confidence, like getting people's confidence back. I think it's the biggest thing of when it comes to aesthetics. It's not about the vanity. It's about getting the confidence back. So I think those
Yeah,
are,
if you don't have it inside, it's not going to show.
yeah,
I can't do that. I can help you with that.
yeah,
That's my thing.
awesome. Well, Krystal, I have one last question for you, but before I ask it, I do want to point people to your website at alpineglowandwellness.com. Now, last question is, what does beauty mean to you?
Mm.
Mhm.
Beauty is something that kind of just shines. Like you can look at someone, you can be in the presence of them, and the happiness, the confidence level that they feel, the surrounding themselves with other people that are like-minded, they're going to push them forward. That all enhances beauty. Beauty is obviously from the inside out, and I know that's cliche, but it's really true. If you feel beautiful from the inside out, then you're going to project it, and everyone around you is going to see it. You're going to light up a room when you walk in, and that is beauty. If you like the way you see and you feel confident, you're wearing your favorite perfume or cologne, whatever it is, your hair looks great. Those are all superficial things, but they help. So beauty is something like, if you were going to ask me, how could I make you more beautiful? I would ask you first how you are. Like, I'm not going to get into the whole mental thing, but do a little quick check-in and give you some options if you're not, and then keep it going, and then work on like, what do we want to do with your aesthetic treatments, and then maybe someone doesn't like how they're doing their makeup. I mean, beauty can just, there's so many realms. You really opened up a little can of worms there.
Well, it's a great explanation that you gave. So, well, there you have it. Krystal sharing her expertise. So, Krystal, where can people contact you in your practice?
So I have my business, excuse me, my business line on me at all times. It's 828-920-GLOW, which is 4569. Pretty proud of that number. They can also, I'm at 37 Mimosa Drive. It's off of Patton Avenue. There's like a Rocky Salt Chicken Shack, and then it's over that way. It's off the like little side road. There's plenty of parking. On February 7th, I will be doing an event at Latan. It's a one-day event only. That's the booking link is on my website. They can contact me through there. They can call me. I do have an AI generated system that they can leave a message with me for, as well as a front office. Her name is Courtney. And then they can contact me through Instagram, social media, Facebook. I'm out there. Just let me know what you need.
Awesome. Well, Krystal, this is awesome. Thank you for coming on, and thank you for sharing your message.
Oh, thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.